chart a course for an exalted future. Africa is a blessed threshold, as major actors in the Africa arena plot a renaissance towards common destiny. Let's pedal across the streams of yesterday, from the backstreets of Africa to the defining roles of policymakers, the political realities of the African nation, balance of power, and the strive to sustain national interest and identity. Join us on Network Africa on Channels Television. Network Africa, a rallying point for the emergence of a new Africa.
On Network Africa this week, the word on the mouths of people is still Ebola, but the Nigerian government has given the assurance that it will do all it can to arrest the situation.
We are doing our best. On Wednesday, I'm going to meet with all the governors of the states. They will come with their commissioners in charge of health, and we must make sure that every state is prepared.
Also, the deadline to form a transitional government in South Sudan has come and gone, but there will be consequences.
The Security Council expresses its readiness to consider, in consultations with relevant parties, including IGAD and the African Union, all appropriate measures, including targeted sanctions, against those who take action that undermines the peace, stability and security of South Sudan.
And Nairobi addresses the plight of African elephants on World Elephant Day. Hello and welcome to Network Africa. I'm Cynthia Are. Unfortunately, the word which is still on everyone's lips is Ebola, including right here in Nigeria. But the good thing is that people are shifting from the realm of fear to the realm of caution and awareness. Chances are high that the Nigerian President, Dr. Goodluck Jonathan, played a significant part in the shift when he vowed earlier in the week to do everything necessary to stop the spread of the virus and appeal to the population to curb risky habits and rituals and heed to the words of the professionals.
Nigeria has 10 confirmed cases of Ebola, up from 7 at the last count, and 2 patients have died, including Patrick Sawyer, the Liberian who brought the virus in.
And so on behalf of our 2 initiators,
the news conference was attended by multi-faith religious leaders, and President Jonathan appealed to the population to stop engaging in rituals that could spread the virus.
As a government, we promise Nigerians that we will do everything humanly possible to contain the Ebola. We are doing our best. On Wednesday, I'm going to meet with all the governors of the states. They will come with their commissioners in charge of health, and we must make sure that every state is prepared. Where they lack, federal government will support the state to make sure that they have what it takes to contain the Ebola.
Sawyer has faced fierce criticism from traveling to Nigeria, despite falling ill after attending the funeral of his sister in Liberia, who died from the virus. Burial rituals are said to have contributed to the spread of the virus.
The Ebola to us.
President Jonathan said he was confident the country would be clear of the virus within a few weeks and urged people not to ignore advice from healthcare professionals.
So we are pleading with religious leaders that most of the traditional things we do, religious things we do, that has to do with sharing of food, sharing of drink, unnecessary body contacts and so on, spiritual healing homes and so on. Within this period, let us manage it professionally. And let us listen to the suggestions of the professional health workers to save our people. If we manage it well, it will not take more than 2 months. We'll get over it and we'll return to our normal life. Immediately people stop dying, then we can get back to our normal life.
The overall death toll from the worst ever outbreak of the highly contagious disease has climbed to 1,013 since it was discovered in remote southern Guinea in March, according to the World Health Organization.
Now let's listen to how the awareness of Ebola has affected the lifestyle of regular Nigerians.
Prevalence of the virus has really impacted on the social life of everyone in Lagos State. I mean, you get to the office in the morning, you're waving to your colleagues instead of the usual handshakes and huggings and all that. So it's really a social problem. And I hope that the government would stand up to the challenge and ensure that we do everything possible to contain the epidemic.
When you talk about people, that's too far. Let's talk about myself. I've been very careful because it is real. Ebola is real. So it's created fear in people, including me. So I will tell people, let them be more careful and let them improve their hygiene.
The kids are all aware, and luckily for them, they're on holidays. Most of these kids are on holidays, so we tell them at home, and really they wash their hands, they sanitize. Every home, I can tell you, every home has a hand sanitizer now, because I was at the mall the other day and I couldn't find a hand sanitizer. So to tell you, every home in Lagos State has a hand sanitizer. So, it has really changed our hygiene system, and I think it's good.
Now, still talking Ebola, after having caused the deaths of at least 1,000 people since it hit West Africa, the World Health Organization has come to the conclusion that it's nothing short of ethical to offer unproven drugs or vaccines to people who are either infected or at risk of being affected by the virus. The decision was made on Tuesday, the 12th of August, when a panel of medical ethics experts came together to debate the matter. However, there is a but, as these supplies will be limited.
The WHO's Assistant Director General confirmed that a wide range of potential treatment and vaccines are available, and several had proven to be effective in non-human primates. The West Africa Ebola virus epidemic has killed at least 1,013 of the more than 1,848 people it has affected in Guinea, Liberia, Sierra Leone, and Nigeria. Hence, the WHO has declared it an international health emergency. The ethics panel met to discuss whether various experimental drugs and vaccines being developed for Ebola might be used in the outbreak, despite not having been fully tested or licensed. While the panel of experts unanimously agreed it was ethical, Kiana said there were some caveats. A specific treatment or vaccine would be a potent asset to counter the virus, the panel found. But Ebola outbreaks can be contained using available interventions like early detection and isolation, contact tracing and monitoring, and adherence to rigorous procedures of infection control. The WHO said it was likely that so-called first-in-man trials, the first test of drugs in humans, would be conducted over the next 2 to 4 months, but cautioned that even after that, and if the trials proved successful, supplies would be limited. The ethics meeting was called after experimental Ebola drug ZMapp, made by U.S. biotech company MAP Biopharmaceuticals, was given to 2 American health workers infected with Ebola in Liberia.
There are some potential therapies and vaccines which look promising, but which have not yet been tested, or if they have, not thoroughly, in clinical trials. Some of these, as you know, have already been used, or others are currently considered for compassionate use. Given the advice of the experts during yesterday's consultation, we will convene them in Geneva again, together with other experts, to advise WHO on how to set the ethical criteria to prioritize.
There are no licensed treatments or vaccines for Ebola. As well as MAP, several other biotech companies and research teams have been working on potential drugs. Meanwhile, with their cracking healthcare systems completely